Low back pain describes pain between the lower edge of the ribs and the buttocks. It can last for a short time, which is acute, a little longer, sub-acute, or a long time, which is chronic. It can affect anyone. It makes it hard to move and can affect quality of life and mental well-being. Low back pain can limit work activities and engagement with family and friends. According to the World Health Organization in 2020, low back pain affected 619 million people globally, and it is estimated that the number of cases will increase to 843 million cases by 2050, which is going to be driven largely by the population expansion and aging. Low back pain is the single leading cause of disability worldwide and the condition for which the greatest number of people may benefit from rehabilitation. It can be experienced at any age, and most people experience it at least once in their life. Prevalence increases with age up to 80 years, while the highest number of its cases occur at the age of 50 to 55 years. Low back pain is more prevalent in women. Non-specific low back pain is the most common presentation, which takes about 90% of cases. It can be a dull ache or a sharp pain. It can also cause pain to radiate into other areas of the body, especially the legs. Today on your favorite Health TV talk show, the physicians will be talking about low back pain, the causes, the risk factors, the presentation management, prevention, and of course the complications. We'll be right back after this time. Do stay tuned. It's another day on your favorite Health TV talk show, The Physicians, where your health is our business. Today on the show, we are going to be talking about low back pain. But before then, my name is Dr. Memuna Yusuf Kadri, and of course with me, my co-anchor, who is the amazing and beautiful.
My name is Dr. Martina Agberie. Welcome to The Physicians, where your health is our business, and we always remain our business.
Of course. Today we are talking about low back pain. And I know you are passionate about this for some obvious personal reasons.
Whatever you like to say. Yes, it's actually a topic that is very close to my heart, because I have a lot of people that are going through the challenges associated with low back ache. And I said I was going to actually ask the doctor today so that he can explain whether orthopedic mattresses are supposed to be for low back pain or to increase the pain. Yes.
Or it's just a marketing tool for those people.
Know, because they'll tell you when you go, you say, no, this one, what do you want? Orthopedic mattress. Is it the one recommended by a doctor or not? If it's recommended by a doctor, this is the one you have to buy. Right. If it is not recommended, this is
no, but have you seen any change? Because before we won't bring in the guest to speak to us about it, you being a doctor, have you seen any change in using the orthopedic mattress because of low back pain or not?
Truth be told, they will tell you with time you get better, but I can actually tell you that I am not actually enjoying it. It's like a stone, and it's not even the real. It's not even the real orthopedic. Okay. When they said this one is doctor recommendation, I said, of course I'm a doctor, this is definitely not what I want. We want
it's very hard.
Send me. Even this one we're complaining now, we said, what if we had bought the one that we orthopedic? So I said I was going to actually ask, is it actually supposed to be for
how long have you been using that now?
That's barely a month.
Barely a month. They say it will take time.
Why
are you in a hurry?
It's not about being
why are you in a because it's just a month. Anyway, we have a guest coming on to the studio to come and educate us, and because he said with time it will be better. It's just a month, and you are still saying that.
The truth is that because
Dr. Akinola is coming.
Because I know that I'm a physician, right?
So
I know with time
it will get better. But you're not enjoying it. That's the most important thing. Life is to be enjoyed, not endured. We'll be right back after this time. Time out. Do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, you jump back supplement for you and me. In your body, that I fight you.
Diarvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diarvite from LB Pharma. Diarvite, love yourself.
Welcome back. If you are just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today, as I earlier said, we'll be talking about low back pain, the causes, risk factors, presentation, and of course the treatment and prevention. With us in the studio is no other person. And if you've ever watched any of our program, you know how amazing it has always been. Very cerebral, a walking encyclopedia, and it breaks it down to a level where each and every one of us will definitely understand it. We, even in the studio as co-anchors and as physicians, as his colleagues, we get schooled. It's no other person than the amazing Dr. Akinola Bolarinwa. It is a consultant orthopedic surgeon and is the MDC of OSTEON Clinic.
Thank you very much.
Dr. Akinola, yeah! I always like when you are here with us in the studio
Nice
because
having you back. It's been a while.
you know, I just look forward to that conversation. It makes us feel, you know, like very calming. And then, of course, while you are calm, you are
Reading out
the bullets are hitting as it is. They're like, where is that Dr. Akinola coming back again? Now you know, go and call all your neighbors, friends, everybody around you is in the studio with us and is discussing something very, very key, very, very key, low back pain. So Dr. Akinola, low back pain, what is low back pain?
Thanks, Dr. Kadri, Dr. Agberian. It's always a pleasure to be here. I never, anytime I get the invite on my WhatsApp from Dr. Agberian, I'm always quick to say yes. And so it's lovely to be here. Thanks for inviting me once again. And of course, low back pain is something we've discussed before, but I think it's always good to talk about it because it's a really big and important problem. As you've already highlighted in your introduction, it's a big problem. And everybody, every adult, almost every adult, not everyone, will experience some form of low back pain at some point in their lives. It's so common, it's so prevalent. And essentially, as you rightly said, it's any pain that occurs between the lower part of the rib cage and the buttock. And sometimes low back pain can actually be felt in the buttock as well. A lot of people say, my hip, and they point to the buttock. But actually, it's the low back pain that radiates to the buttock. So low back pain is very, very common. Very, very common. Yeah.
So, of course, in my interest, said is the leading cause of like disability, you know, worldwide now, and we know what it is. We discussed earlier on in one of our programs, pain as it is, but now we are now narrowing down to low back pain. Yeah. Can you elaborate more on what are the different types?
Absolutely. So, for us as physicians, for us as orthopedic surgeons, the commonest cause of low back pain is what we call mechanical low back pain. And essentially, it means harmless low back pain. What I mean by harmless is, in the wider scheme of things, there are some low back pain that we get really worried about. And patients oftentimes need treatment. However, the vast majority of low back pains actually will not cause any long-term harm, physical harm to the patient. They might be uncomfortable, they might be a source of, as you rightly said, disability, but with the correct treatment, people learn to cope with them. So that's mechanical low back pain. So whenever I have a patient come to me, I as a doctor, it's very, very, very difficult for me in what I do to simply reassure patients and say, oh, this your back pain is mechanical low back pain. Yeah, there are some characteristics in how they describe their pain that makes me think it's probably mechanical low back pain. But what is important for me as a doctor is to try and pick out those harmful back pain and make sure that my patient does not have any of that harmful back pain. So that's what is important for me. So the causes fall into, so just for ease of description, harmful and non-harmful. Non-harmful forms the vast majority, harmful forms the smaller proportion, but the important ones that I as a doctor should not miss. And to guide that decision making, we have identified some features. We call them red flags. So when you have, like if you follow F1, Formula One, whenever, if you have to raise a red flag for someone, that probably means that they've committed an offense. You have to check carefully. So the same way, if a patient comes to me with a red flag symptom, it's a reason for me to take a pause and think again. So for instance, if you're under the age of 20 or over the age of 55 and you're complaining of back pain for the very first time, I get worried. Okay? And I want to say, should we be looking at this a little bit more closely? If you've had any significant trauma to the back, I get worried. If you have had a past history of cancer, or you're presenting with symptoms suggestive of cancer, weight loss, loss of appetite, I get worried. If you have a history of steroids use because of the drop in immunity, possible infection, I get worried. For patients that might be HIV positive as well, I get worried. So when a patient comes to me, I go through, and of course, if you have any neurological symptoms, maybe like urinary retention, pain going to your legs, numbness, loss of power, weakness, I get worried. So I go through all of that and I ask myself, do I have a harmful cause here, or do I most probably have a non-harmful cause of back pain?
Okay, so now you talked about the non-harmful and the harmful cause.
Yes.
You just want to break it down again so that we can understand the presentation. How do they present, those that have this kind of causes?
Absolutely. So
risk factors, if possible.
So it's interesting because sometimes it just takes an index of suspicion. Some of them are pretty straightforward. Say somebody, for instance, fell down from a height. And after falling down from a height is in a lot of back pain. That already suggests to me that this might be a potentially harmful cause of back pain. Or somebody comes to me and says, doctor, I'm having so much back pain. All of a sudden I realized I couldn't move my foot anymore. Or all of a sudden I realized that I can't urinate anymore. I'm uncomfortable. I feel like going, but I can't go. That exactly, retaining urine. That already suggests to me that, this could be a harmful cause of back pain. But if somebody says, doctor, I have some pain, it's just there at my back. Anytime I turn to one side, it's a little bit more painful. But if I adjust to another side, it feels a bit more comfortable. I take some paracetamol and the pain gets better. It doesn't stop me from sleeping at night, but I'm just worried about it. Then I'm thinking this is most likely a non-harmful cause. But the truth of the matter is that there can be some overlap of these symptoms. I saw a gentleman recently who had been having pain since February. And initially the pain could be ignored and could be dealt with just taking paracetamol. But a few months down the line, he was in excruciating pain.
So this is over 6 months now?
Yes, over 6 months. We got an MRI scan and he had destruction of his bone because of underlying tuberculosis. So those are some of the things that may happen. So I, as a doctor, must maintain a high index of suspicion to make sure that we are able to continue to decipher between harmful and non-harmful. However, as I said before, the vast majority of cases will be non-harmful. And how do they present? Pain, sometimes works with movement, sometimes relieves easily by just taking simple painkillers, doesn't really affect, even though it's there, it's a nuisance, it doesn't stop you from doing what you need to do. It might hurt more towards the end of the day. When you're moving around and walking around, you don't really feel it as much. So those are some of the characteristics. Sometimes it goes to the buttock, and yes, so those are some of the characteristics you get with mechanical low back pain, which is by far the commonest.
So do you classify this mechanical low back pain? I want to understand it with respect to a sedentary kind of lifestyle. So you sit for a long time, the kind of pain you experience.
So that can contribute. So of course, when you talk about risk factors, we talk about, you can classify them into genetic and non-genetic. There are some people that are just predisposed to back pain. And it's something that runs in the family maybe sometimes. and they're just predisposed. But there are other things that can contribute to that. Obesity, for instance, you carry a lot of weight, you carry a lot of load on your head. The vast majority of underlying causes is also postural, bad postural habits, the way you sit, the way you bend, the way you walk, people who are a bit sloppy. And then, of course, lack of exercise, like you said, about sedentary, because as we get older, our core becomes weaker. Our core becomes weaker. It's not quite as strong anymore. And if you're not the type who exercises regularly to build up your core to support the rest of your body, then that weight begins to tell. The muscles are not quite as strong, and then you start to feel some pain.
What is the right sitting position?
Ma?
What is the right sitting position?
So the advice tends to be try and keep your spine as straight as possible. So when you're sitting down, instead of slouching forward or slouching backwards, try and sit as upright as possible. But what has also but what has also been identified is change positions constantly.
Okay.
So rather than staying in one position for a prolonged period of time, if you've been sitting for 30 minutes at a go,
30
stand
minutes?
up.
Just 30 minutes?
Yeah, for example, stand up, move around. Move around for like 5 minutes, do some stretches, come back and sit again. For many people that work with workstations, many times they have to lean forward to be able to work on their computers. Get a table that allows you to lift up your workstation to eye level so that you can sit with your spine straight as much as possible and be able to do your work.
Can you put something at the back?
Yes, you can put a support.
And this just takes us to COVID, post-COVID, and we're getting out of it now. As an orthopedic surgeon, how frequently do you get to now see people with complaints such as this? And because we have remote working now and all that.
Sure. I mean, I see low back pain all the time. The thing though is people get a bit frustrated when you discuss how they will manage it, because when you go to the doctor, you expect this is the problem, this is the fix. Unfortunately, low back pain does not even have a fix, especially for the non-harmful ones. It's a lifestyle modification. It's a lifestyle adjustment, and it's something that people have to put the work in, both to prevent it and to manage it.
The thing about low back pain that really bothers me is the fact that there are some myths, and people say that, because it's more among women again, which I don't like, because everything we say in this studio, a lot of times is women, right? More among the women. And we've had this myth that as you grow older, and because you have had babies, for those that have had babies, you tend to slouch or you have more back pain. Is that a myth, or there's some form of fact in that?
Well, it's a mixture of factors, essentially. First of all, as you get older, as everybody gets older, you undergo what's called degeneration. Not just the joints of the limbs, but also the joints of the spine. And degeneration in itself is a cause of pain. So as people get older, they can have pain as a result of degeneration. So that will be one of the underlying causes of mechanical low back pain, although that can also move on to not just mechanical low back pain, to something more serious that may need something doing. But in terms of childbirth, the correlation between, especially for women, the correlation between, say, childbirth and low back pain is all relates back to the core. I mean, you've already had multiple pregnancies. When you get pregnant, your center of gravity is thrown more forward than usual, and then you've finished that pregnancy. Within 2 years, you have another one, and you haven't had a period where you've actually taken time out to strengthen the core, to develop your core strength again. And then as the years go by, age also has impact on the body, and all of that plays its part in why that tends to be the case. Yes.
Dr. Martina has a question on orthopedic beds.
Absolutely.
And I think you need to take it.
Yes, I was just going to ask, because we have a lot of orthopedic mattresses now.
Yes.
And so we'll tell you it's semi-orthopedic, normal, semi-orthopedic, and orthopedic.
Yes.
And it'll tell you the one that is real orthopedic is supposed to be recommended by the doctor.
Yes.
Okay, so I don't know if it's actually a marketing strategy, because the semi-orthopedic,
Yes.
I don't want to say it's even harder than the floor.
Sure.
It's hard.
Yes.
So is it supposed to actually help the people that have low backache,
Sure.
or it increases the pain?
Sure.
Because I'm speaking from experience. We recently got a semi-orthopedic mattress,
Yes.
which is hard, but then the pain, I haven't seen any change really. Yes.
All right. Thank you for that question.
So I need to really know if it's important for
Yes.
us to continue using it.
Sure. Sure.
Yes.
And of course, for
the
our
reasons,
viewers,
what
yeah.
are the reasons why they usually will recommend orthopedic? Because I know growing up,
Yes.
they would say if you have a back pain, lie on the floor.
Yeah.
Okay, so we need to understand the reasons why we have to lie on the floor and on your back.
So thank you very much for that. A lot of things boil down to trying to maintain a straight spine as best as possible. Unfortunately, many of the things being marketed as orthopedic beds they're just completely
Not orthopedic. So
not
it's marketing
they're not
strategy.
effective.
Wow.
What is an orthopedic bed really? So companies do research. They get a group of people, they design a mattress, and usually it's going to be a conforming mattress. It's a mattress that sort of conforms to your body, while at the same time not allowing your back to sag too much. That's what you get with soft mattresses. With soft mattresses, there's no conformity. Your body just sags into the consistency of the mattress. With mattresses that are a little bit more firm, it can, so they call them sort of memory mattresses. It kind of like adapts to you a little bit, but also holds you up a little bit as well. And if you actually check the consistency of those mattresses, they're not hard. They'll be on the firm side. So they're between soft and firm, not too soft, not too hard. But what happens with a lot of these marketing devices is the proper ones will take like 50 people or 100 people, get them to sample this thing over a period of time. 60% of them might say, oh, it really helped us. And then
So
they
it's more
market
sample
it.
size.
So that then becomes a fashion. It becomes a trend. So everybody gets a stony, hard mattress and says, this is an orthopedic mattress. So it's not exactly true. So what I tend to advise people, and then we're all different. There's no one size fits all. So what I tend to advise people to do is try different types. Yeah, it might be a little bit expensive, but what you could do is if you have a deal where you can say, can I return this within 30 days if it doesn't work? So leave the cover on, try it for like 1 or 2 weeks, see if it actually makes a difference. If it doesn't make a difference, get another one. But overall, don't get something that is too hard. Get something that is firm, but not too hard. I have a very soft mattress in my house.
With it.
I'm not actually.
Okay.
But, so I stay on it sometimes, and I wake up in the morning and I'm in pain. You know, because it's just too soft for me.
It's time to
Meanwhile,
change.
I have another mattress that is a little bit on the firm side. It's not hard, but it's a little bit firm. And this is just a normal mattress that we bought in the furniture shop. And that's really
that's doing
useful
the
for me.
magic.
Absolutely.
Because they don't have the type now that they say is semi, right? Half of it is orthopedic.
How will I know the side that will
And
sleep?
the other side is
No, because
not
if you are the
orthopedic.
type that roll from one end to another, that is, in fact, you know what, Dr. Akinola, let's go to the diagnosis.
Sure.
Whether imaging, physical assessment, how do you make diagnosis?
Absolutely. So imaging is very important. Of course, clinical examination and history taking is very important. As I said, the way people present to you, the kind of things they tell you, you already have an idea of what is going on. But imaging can be indicated in a lot of instances. So when somebody first comes to see me, I do a history with them, and based on how I assess them, if I think they've come with mechanical low back pain or the non-harmful ones, I give them medication, I advise them on exercises, come back to see me in another few weeks, 2 or 3 weeks. Let's see if you're getting better. If they come back, they're not really getting better, then it's time to start exploring more. And the mainstay of imaging are x-rays. X-rays will show you the bones very, very clearly, and will show you things like spondylosis, which is another word for degeneration. Will show you things like if there's a small fracture around, especially for people that have had trauma. X-rays are very good at showing you fractures. But then next level is an MRI scan. So X-rays, MRI scan, those two are the workhorse of investigating for low back pain. So if somebody comes to me, for instance, they've been having pain for a year, they've been trying to cope with it, it's not getting better. The first thing I want to do, as I said before, is let's just make sure there is a non-harmful cause for this thing. So let's rule out any harmful cause. And the best way to do that is with an MRI scan. Does everybody need an MRI scan? Absolutely not. Does everybody need imaging? Absolutely not. But more often than not, a lot of people will get the X-ray as a starting diagnostic imaging. And then if necessary, they can then get an MRI scan as well.
You've heard it all from Dr. Akinola Bolarinwa in the studio. You know, maintaining your posture is very important. I'm sure if you paid attention to this program, you'll know that from time to time, even if I lose attention, I kind of adjust my posture because I don't want it to say that, you know, I'm slouching or whatever, you know, I'm getting older by the way. So please, there's not a one-size-fits-all. The issue of orthopedic mattress, you've heard it, you know, not too soft, not too hard, something that can help you maintain your posture. If the pain is very acute, yes, painkillers can help, but see a doctor because it could be just much more than what you thought it was, so that you can do some investigation and it can be nipped on board the cause of what that pain is. One thing I want to let you know is that while we think that painkillers are used for everything, when it comes to low back pain, it could be a devastating issue. So don't just stick to painkillers. Make sure you see your doctor so you can get the right treatment. My name is Dr. Menmuna Yusuf Kadri. Until next time, remain blessed.
Thank you very much, Dr. Akinola, for coming to and talking about this low backache. As the word low backache, very, very common. A lot of people are going through it. You just broke it down. Really appreciate you. And I'm sure we're still going to call you back again so that you don't stay too far from us, the physicians. And to everyone else, they just want to say thank you again for keeping a date with us. Low backache, the kind of the causative factor that is for you may not be the same with another person. Just do that which is right for you. Hard surface, low, firm, soft. Decide the one that fits best for you. So my name is Dr. Martina Agbere. Until next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Daravite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Daravite from LB Pharma. Daravite, love yourself.